We welcome all to this informative and interactive show, the Pundit Show by Dr. Ritu Santwani, supported by InnovCare Life Sciences, the makers of metinofol, proinofol, and Inofol HB. Myself, Sankalp Sane, the Associate Marketing Manager at InnovCare Life Sciences. Welcome, Dr. Ritu Santwani, and nutritionist, Ma'am Sheela Tanna. We have, welcome, ma'am. We have Dr. Dalip Gadhavi. He will be joining soon. About InnovCare Life Sciences, we are engaged in marketing specialized innovative products across the country in the field of infertility as well as pregnancy care. To begin with this session, first I would like to introduce our eminent speaker, Dr. Ritu Santwani. Doctor is specialized in IVF, infertility, TestTube baby. Doctor is director at Pune TestTube Baby Center, having 20 years of experience in the field of OBS and Gynae. Doctor is having expertise in the field of IUI, ICSI, IVF, assisted hitching, egg and embryo donation, surrogate mother, male infertility, semen banking, embryo freezing, sexual and psychological problems, and tried to give moral and emotional support to infertility patients. So, doctor, welcome you for this. Doctor.
Yeah, thank you, Sankalp. Only 1 minute, I want to interrupt you. Weber, please check. I am able to see Dr. Dalip Gadhavi name in the participant list. Please take him on the speaker list, so we can able to see him also. Yes, you can go ahead, Sankalp. Yeah.
Yeah, let me introduce our next speaker, Ma'am Sheela Tanna. Ma'am, welcome, ma'am. Ma'am is having 17 years of experience as a nutritionist and fitness consultant, specialized under weight loss, diabetic management, PCOS, blood pressure, and cholesterol management. Madam is a regular writer in Times of India publications, Bombay Times, Mumbai Mirror, and Femina. Ma'am has successfully completed 3 TV shows for Care Channel and have been a regular speaker on several platforms. Former consultant dietitian at Ambuja Cement and attached with Criticare Hospital, Andheri, Sanjeevani Hospital, Andheri, Mumbai, and also KLS Memorial Hospital at Vileparle. So welcome, ma'am, to the show.
Thank you so much. Thank you so much for inviting me, Dr. Ritu.
Most welcome, Sheela. Yeah. Please introduce Dr. Dalip Gadhavi also. Then I will start the program.
Let me introduce our next speaker. Very soon he will be joining Dr. Dalip Gadhavi, the president of Ahmedabad OBS and Gynae Society, the secretary of Gujarat OBS and Gynae Association, the vice president at IMA, and past vice president at IMA Gujarat State, India, secretary at Indian Menopause Society Ahmedabad chapter, and organizing secretary of IMA NatCon 2014 and member of DNB board committee. So welcome Dr. Dalip Gadhavi to the show. Thank you so much.
Yeah. Thank you, Sankalp, for the kind introduction. Why we are not able to see? Yes. Yeah. Hi, Dalip. Welcome. Yeah. Welcome. Yeah. Good evening.
Fine?
Yeah. Fine.
Happy to see you all.
Yes. Same here. Yeah. So a very warm welcome to my 2 Pundits, and today we are having a very special show, friends. As all you know, the Pundits at Dr. Ritu show. In this show, we are doing always all the practical discussions. So today, I have invited 2 of my very, very special friends. Both are specialized in their own field. So today we are going to discuss a very special topic. The topic is actually suggested to me by my very dear friend Dr. Dalip Gadhavi. One topic is suggested by him and one topic is suggested by my other dear friend, a very famous dietitian, Sheela. So what I thought we will combine these 2, and so everybody can get benefited. So friends, as all of you know that in this corona pandemic ने हम सबको हिलाकर रख दिया है. So there are so many changes, not only by everyone's lifestyle. So now, what the changes we have done, what the changes in our lifestyle, on that we are going to have a discussion with our very own friend Dr. Dalip Gadhavi. And regarding the other topic, what we have taken, the Fit Fest. So no one else is the better to guide us on that if the Sheela is there. So Sheela will guide us around for all of this, that how to remain fit and what is the dietary modification in the different metabolic diseases. So with your permission, my 2 special Pundits, shall we start our virtual happy hour? Dilip, can we go ahead?
Yes, definitely. See,
Yeah,
I suggested use this subject because there are a lot many webinars are going on since the
yeah,
this corona pandemic, and
yeah,
everybody is learning the same thing every weekly. So I
yeah.
thought let the subject remains the same, but
Hmm.
the thought and the idea to be get changed. So we are,
Yes,
my focus is on the sociology.
yeah,
So that's why I asked you to go for the subject, but with a different reason.
yeah, yeah. Very
So,
true, very true.
so you
Yeah.
can ask me anything
Yes,
which you
yes,
want
yes,
to
yes,
know.
yes. I'm going to start. Meanwhile, I want to welcome some of our very dear friends have joined. Kiran
Hmm.
Sena ma'am, the secretary of Kanpur Obstetrician Society, has joined.
Very
I
good.
am able to see the Alka Sethi ma'am from the Jhansi. Ma'am is also the president of the Jhansi Society. Ma'am has also joined. And so, welcome all of our friends who have joined. Yeah. So now my first question to you, Dr. Dalip Garvi. So now, what was your
Yes.
first reaction when you got the news about this regarding this corona pandemic in our India,
Yes. See,
and how does
exactly.
it change? Yeah,
We people came to know about this COVID-19 infections in the early of the January, because at that time, lot many things started that there is some viral infection going on in the China,
yeah,
and this viral infection can be spread. But at that time, nobody thought that it would spread like this much. The whole world will be suffering because of this COVID. So at that time we came to know, but everybody thought, "Okay, it must be get controlled, or virus has its own limitations, its own lifespan, and will get limited by itself own." So first we came to know in the January regarding all these things.
yes. Yeah. So once this news has come to in our doctor fraternity,
Yeah.
so what do you think? What was the reaction of our fraternity, and how does it changes the lifestyle before and after this 25th, 23rd of March?
Yeah, see, when this pandemic started, first it from China it goes to Europe, then in America, and then the number of India and Pakistan came. So in the beginning, we people thought that just we will be going for this lockdown, and we'll be able to manage it and will control it. So it was little bit difficult task for all of us, because on the I think on the 23rd of the night, at least around 8:30 or 9 p.m., the Prime Minister declared that night from 24th onwards, everything is locked down. There will be no business, nothing else, no transportation. So we feel as if we are running and we are falling down. So it was very shocking when we came to know that from tomorrow onwards it is a lockdown. But as a doctor, we understand, okay, if there will be social distancing and sanitization and mask, it can prevent the disease by spreading. And the prime focus of the government was to stop spreading in the community spreading. But unfortunately, nowadays we are seeing it has already spread in the communities.
Yeah,
So
yeah.
it was a little bit shocking for us that everything is shut down from the 24th of the March.
Yeah, yeah, yeah. Thank you so much. So, what I am going to do, I am asking some questions to you, Dr. Dilip, and some to
Yeah,
our nutritionist Sheila. So,
yeah.
everybody will keep because some have joined for this dietary and some have joined for this corona. So,
Yes, yes.
yeah. So, my first question to you, Sheila, as we are
Yes.
seeing so many patients of this diabetes these days, especially in the lockdown period also so many patients have put the query also regarding, first of all, I'm taking a very practical topic which is very common in our metro cities regarding this alcohol. अभी क्या हुआ था, अल्कोहल के लिए सेल बिल्कुल बंद हो गया था, जहां गवर्नमेंट ने अल्कोहल शुरू किया, we have seen the queues.
Mm.
So I
Yeah,
want,
that's
yeah, so I want to know that how this alcohol affects on the sugar metabolism. What do you advise if the patient is dropping us the WhatsApp message ki ma'am, we are diabetic, but now in this lockdown period, so we are so bored and so depressed, want to take the alcohol. So give us little bit of info regarding this.
See, alcohol can do both depending on the amounts and types. Some moderate amount of alcohol can raise your sugar level, like beer and sweet mixes, sweet sugary mixes. But larger amount of alcohol can lower your sugar level by suppressing liver's ability to release glucose into bloodstreams. So one need to be very careful and watch out not to binge drink.
Yeah, thank you so much. And because in this lockdown period, most of the patients are sitting at home having, they are saying कि नहीं मैम हम कोको कोला और ये सब नहीं लेते, we are fond of diet coke. So what do you think, is the diet coke is good for them?
No, see, too much of colas and diet cokes and sodas can irritate our gut area. And when our GI tract is challenged with poorer choice of food and stressful lifestyle, it can send our metabolism on a toss, and that can lead to poor sugar control. So always to have little diet sodas and colas in moderation, even if they are diet cokes.
Yeah. So according to you, Sheela, that how much of the carbohydrate per meal is allowed for this diabetic patient? Because I want to get some insight regarding the diabetic diet.
Yeah. See, if you focus on right types of carbohydrates, you don't need to worry about how much carbohydrate should I eat. It is a complex carbohydrate. Shift to complex carbohydrate. Have, instead of refined dals, have whole dals. Instead of refined juices, have whole fruits with fiber. Instead of high carbohydrate like upma, poha, idli, dosa, white rice, simple poha is refined carbohydrate. If you can add a little bit of grated coconut, if you're adding coriander, if you're having mixed sprouts, it becomes complex. So if you're having complex carbohydrates, if you're having fiber-rich food, if you're active, you don't need to worry about how much you eat. It is more important what you eat. It is not important how much you eat. So shift to complex carbohydrates and you don't need to worry about how much should I eat.
Okay. So thank you so much. But my one more query is that in the cases of the diabetes, as we say, the timely interval, the diet. So what do you suggest this regarding for this skipping of lunch or skipping of breakfast?
Yeah.
Because so many.
See,
yeah.
Skipping meals can send your sugar, glucose on a sugar roller coaster ride. And it can actually liver can actually release too much of glucose into bloodstreams when no food is eaten, pertaining hunger situation. So you should never skip your meals because your sugar level may fall down. So have whole carbohydrates, complex carbohydrate meal along with good first class fat, first class protein, and a lot of fiber. So your sugar level will never fall down. Have smaller meals, balanced meals entire day.
Sheela, in this, I want to be little specific. As see, so many of patients we gynecologists are seeing, some are suffering from gestational diabetes. At the time of the pregnancy, the diabetes is starting, and we consult with the physician also, and we start the insulin, shifting from metformin to insulin. So, is it something like especially you want to suggest? So we give the take-home messages to, or because in this our forum we are discussing with all our doctors. So we pregnancy with your diabetes, what should we suggest to our patients from the diet therapy? We are using the term is MNT, the medical nutrition therapy. So will you enlighten us a little bit about that?
Sure. See, we have a lot of limitation when a pregnant lady has pre-diabetic stage or a diabetes, because you cannot give few things like methionine. Methi is very popular in diabetes, very effective in diabetes control. But when a lady is pregnant, you cannot give methi because it may lead to diarrhea, right? You cannot give too much of raw food. If you give too much of raw food, there is especially in this pandemic, there is a chance of contamination. You cannot give too many ripe fruits. So one should have protein-rich breakfast, maybe an egg or maybe avocado, maybe coconut, or maybe a lean meat on a high fiber toast. In between, you cannot even give green tea. Right? You cannot give caffeinated drinks in pregnancy. So you can give them lemon water. You can give them ginger water because even ginger is anti-inflammatory and it may lower your sugar level. You can give them herb-infused water, which is hot, because right now, because of this, you cannot give them raw ginger. right?
Yeah.
So cinnamon water is good. Even haldi, golden water, but that also very much in limit. It should not go over the board. So one needs to be very, very careful while treating a pregnant lady. Then you best to shift to low glycemic index diet. Anything you have, combine it with good fat, which is coconut oil, maybe cow ghee, load curd, cow ghee. Load curd is you buy cow, you make it at home. Okay, outside ghee is always bleached.
Hydrogen. Yeah.
It is hydrogenated, it is bleached. So always make cow ghee at home, right? And store it in a glass bottle, not to buy what is available outside, because it is stored in plastic bottle, number one. Number two, it is to increase their shelf life. They may chemically bleach it, right? So always have homemade cow ghee. At least 2 teaspoons of melted cow ghee is excellent. Even Ayurveda mein likha hua hai कि it is very, very sattvic, right? Always have, suppose now a simple khichdi. Khichdi is a national dish, right? So it is refined because people use white rice and a smaller amount of dal. Mix all the dals, mix all the pulses, add a lot of vegetables, and make that khichdi. Add 1 teaspoon of ghee. So it becomes a balanced ahar, ek sattvic ahar ban jata hai. So that will not let your sugar level go high. Have a lot of warm fluids. Have fruits which are low in glycemic index, like all the berries, all the jamuns, apple, orange, sweet lime. These are low glycemic index fruits, which are the glycemic load is less. So even if you have 2 apples a day, your sugar level won't go right. It won't rise.
Yeah.
So yeah, while treating a pregnant lady, one needs to be extremely careful, not just to use Google knowledge and apply any theory. So best to go to a professional person, and a tailor-made diet chart needs to be prepared.
Yeah. Yeah. Thank you so much. Want to add something? Yes.
Very good. Very good.
Yeah, a simple dosa. A simple dosa is white rice and little bit of refined dal. But if you mix all the dals, if you mix all the pulses, and if you soak it, if you grind it, and if you add onion, tomato, coriander leaves now, because of pandemic, a lot of it is very much highly recommended. If you add ginger, if you add chili, so this becomes a whole meal itself. And if you have coconut chutney with it, so you're adding a lot of good fat to it also, so it becomes complex carbohydrate. So everything has to be complex. So your sugar level always will be maintained. It will always be in one flow. It won't go down, it won't rise also.
Yeah. Thank you so much, Sheela, for sharing this practical tips. Dalip, you want to add something in this?
I was just listening. She was very nicely evaluating the things, what is to be done, what is not to be done, and how it helps to the patient.
Yeah.
But Ritu, so far as addiction is concerned, it is the worst thing, because people, those who are addicted with the liquor or tobacco, which is more in Gujarat, masala, mawa, jisko bolte hai, so they were crazy. So people were such a frustrated. Everywhere they go and went to go, and for 2 rupees things they were paying 20, 40 rupees. Gutka aate hai na?
Yeah.
So liquor or gutka, for the addicted, this period was very tough period. And you know that the moment government allowed the liquor shop to be get opened, and we know the queue was longer than that operations queue. So these are the things.
Yes. So actually, Sheela has explained very nicely. Sheela, I want to add something. My specific query when I asked you, because see, we are in the metro city. So many patients of my patients have put the message, ma'am, we are having a red wine. So now we are not getting a red wine also. I am asking you all the practical scenarios, what we are getting day by day in our practice. So what is your recommendation regarding of this red wine?
Red wine has polyphenol, which may stabilize your sugar level, but ultimately it's carbohydrate. So dry wines and dry beer and red wine is less in carbohydrate, and it is less in calories also, but not more than 2 drinks a day for men, and not more than 1 drink per woman. That is a 5-ounce drink. 1 drink is 5 ounces.
Okay.
Always drink slowly, always drink along with meal. Never have it empty stomach, and always mix it with unsweetened soda or water or lemon water. So if you take care, then your sugar level will never rise nor it will fall.
Yeah. Okay.
And
Yeah. Thank you.
if you mix it with sweet juices, it may raise your sugar level.
Of course.
Yeah. Thank you so
Yeah.
much.
And
Yeah.
not to forget fried cashews, fried sing. Of course, ये सब नहीं खाना है. Always have roasted.
Yeah. Thank you. A very practical tip. So now coming to Dr. Dilip. Dilip, my next question is that as in this corona pandemic has come, so what do you think? Because our show is for the doctor's lifestyle. So what do you think? How it has changed our practice scenarios, daily practice scenarios?
4th of the March, we were so casual. Anybody can come to the consulting room. Patient was sitting beside the doctor. We were touching her. We were measuring the blood pressure, temperature. On per abdomen examination, we were touching. So it was very friendly atmosphere in the consulting room. The moment we came to know that this is a corona and it can be spread by touching, by sneezing, or by anything, we become extraordinarily cautious. So first of all, the distance, social distance and mental distance, both distance were increased between us and the patients. So many doctors started that you should sit 3-4 feet away from me. They don't touch the patient. They don't allow. Even I have seen the many consulting of the many doctors. They removed all the chairs other than the doctor's chair. The patient has to come, has to stand in the front of the doctor. She can talk.
Okay.
He examine, if required, doing the sonography and writing the reports on the not on the regular case paper, on another paper. And if they ask, they put your paper in the file, and every time they examine the patient, they put another prescription in the file. So this has been changed. Another thing, we ourselves has to be very much cautious. So we started wearing the PPE kit, mask, face shield, and extra precautions to keep ourselves secure and safe from this infection. But as you know, Ritu, that in common men, the rate of infection is 5 to 6%, while in doctor it is 11%. Our mortality is 11%. Today also we have lost 5 doctors all over the India of different branch consultant doctor. Today also we have lost.
Yeah. So saddening. Yeah.
Sad thing. We are daily losing 5-6 our colleague, and most of them they were busy in treating the COVID patients. Irrespective of the branch.
Yeah.
That is a very sad part.
So, according to you, Dilip, what this lockdown decision was taken by our Prime Minister, is it correct decision? Is it a timely decision, or it is a little late decision?
This is a very debatable issue, because as per the data, when we lost 500 lives in the India for the COVID infection, we implemented lockdown. And when we reaches higher, we opened it. But there is also another thing, that how long you can keep the lockdown. That is the thing. Because how long government can feed the poor, that is also a problem. Because for almost 2 months, government provide most of the facilities to the poor public, those who are not able to get their money from this job or from their other resources. So government help them. After all, we are a poor country, and government also has a reserve fund, but it has their limitations. So there was no other way to open it. But after the opening, we as a citizen, we must respect, or we must understand the situation, and we must follow the COVID lines. So I have seen many people in the city, they are roaming as if now corona is no more in the India. They are not using masks. They don't keep social distancing. They don't use sanitization. They don't keep anything which government is asking you as a citizen. So that is another problem. So this is a debatable issue. That it was implemented this at the right time, and it was open at the right time. So
True.
The side we are losing.
Yeah. Meanwhile, I want to welcome Dr. Manjeet Mehta has joined us from the Mumbai, and our very dear friend Dr. Archana Devedi is also joined from the Vadodara. Dr. Dalip, so some doctors have joined from this Ahmedabad and Gujarat also. Dr. Jay Prakash Bhatt has also joined. So welcome all of you. So Dilip, my next question to you: this when this lockdown is started, so what do you find? What's the reaction of the patients?
So, when lockdown started, most of the patients were not aware exactly what is this, what kind of infection in this, why government has all of a sudden lockdown of India, where there is no buses, no railway, no flights, and all the shops are closed, all the factories closed down. So people were not aware about the disease. But after few days, after watching the TV and other things, they came to know that this is the one kind of infection which has spread from the China across the world, and we also have become the victim of that infection. And to prevent ourselves, to keep ourselves safe, we have to follow certain things. In that particular SMS, sanitization, mask, and social distancing, these three were the prior thing. And then people started following it. But in many areas they don't understand, so at that time the government has to use police force, at some places SRB, and they have to implement curfew also in some of the area where people were not ready to follow these COVID guidelines in a social distancing.
Agreed.
So
Yeah.
this
Thank
kind
you.
of
Hope
things
that you
also
all are
in India,
safe,
people have not
healthy,
seen this
and
kind of
providing
thing.
your
People
service
have
with
seen
utmost
lot many
safety
riots in
precautions.
India,
We are
lot many other
grateful
things.
towards your
But this kind of
devotion to the
pandemic disease, and because of that, the government to shut down everything. This is for the first time in the India.
True. Yeah, agreed. Yeah, coming to Sheela, I got one inbox regarding the use of the oats. So, what do you suggest the regarding of the use of the oats in the diabetes?
Okay, a lot of people, they do complain that oats also increase our sugar level because oats are considered breakfast, right? So if you use instant oats, rolled oats, and if you use it in larger quantity, right, then it tend to, and of course you add muesli, which is honey coated, or maybe they have maple syrup, or maybe they have a lot of berries, then it may increase your sugar level. So always go for steel cut oats, which are unprocessed, which are high in fiber, and 1/4 cup of steel oats is 7 grams of first class protein.
So now,
That
see, yeah, I want to know your opinion, Sheila. We are these days getting many fancy things: oats idli, oats paratha, and once we travel in the airport, also there are a lot of this. They have quoted in their pantry shops and all that oats idli, oats paratha, oats roti is available. So, what do you think? How much nutritious is that?
zero nutrition.
Okay.
Because all the packaged food is full of salt, full of preservative. You cannot preserve anything if you don't add preservative, right? So no packaged food is healthy. Always have homemade, always trust what you make it with your own hands. Never to have anything which is packaged. It is full of trans fatty acid. Dr. Gadhavi is from Gujarat. I'm sorry, but most of the, even I'm Gujarati, so I know their breakfast is incomplete without gathia and jalebi, right? Now, yeah. So I've heard a lot of Gujarati saying કે પૈસા કમાઈએ છે સેના માટે અગર ના ખાઈએ તો, right? So one oil, if you outside fried food ka ek aapko secret bata rahi hu कि why you should not eat it. Once you fry something, that oil turns into trans fat acid, which is the biggest villain today, right? It increases your sugar level, it increases your bad cholesterol, and it decreases your HDL, which is a known thing, right? Now that oil, outside fried oil, they never change the oil. They keep on adding new oil. They keep on frying outside samosas, outside puris, outside gathias. How unhealthy those packaged foods are. So if you want to use oil, you use ghani oil. That is the best oil. You don't need to use expensive olive oil from abroad. Yeah, locally available ghani oil is best. Lone curd cow ka gai ka ghee, that is sattvic. Use cold pressed coconut oil. Coconut oil is so much better right now. But don't ever have anything which is fried outside.
Okay.
Because this is a full pack of trans fat acid. So younger children, even that's why younger children, they are falling prey.
Yes.
Today,
So we,
syndrome X, that is considered as a second world epidemic today. So because all the time people are having fry food, US is zero trans fat, UK is partial trans fat, and India, nobody cares about trans fat. Our grocery stores are packed with all the packaged foods.
Yes.
Whatever is packaged, whatever is instant, whatever is packed in plastic, it should be banned, and one should never have.
Yeah. Thank you so much, Sheela. Sheela, ghani oil means you are telling about this mustard oil to us?
Yeah, all the oils are good. Sing tail, til,
Okay.
sunflower oil, whatever is freshly squeezed is excellent, and which is not stored in plastic.
Okay. But most of the oils are available in these days, the plastic containers or plastic bottles.
No, but now even BPA free plastic is available.
Okay.
BPA free plastic is available, and this plastic usage, everybody will agree with me that thyroid cancer, one of the reasons is plastic. Yes, because that BPA gets seeped into your food, and once you heat it or once you refrigerate, that seepage accelerates.
Yeah. So regarding this, what is rice brand oil? What are available these days? Regarding that, because so many advertisement is coming from very good brands, this Saffola and all these brands, all are promoting their rice brand oil. So what's your opinion?
Whatever is commercially available, whatever has longer shelf life, whatever is packed in plastic bottle is not good for you. Because to increase the shelf life, they bleach, they re-bleach. So whatever is bleached is never good for us, no matter how bigger the brand is.
Yeah. Thank you so much. Sheela, one more point, as you told us about this regarding this packed food. So, what are the population we are getting in our day-to-day practice? Most of these young girls, especially I'm talking about Pune. So many girls have come from outside of the Pune and they are here either for the studies or either for they are doing some job in the IT sector. So, कभी भी आप उनको बताओ, most of the girls are coming for this PCOS problem. So कभी भी उनको बताओ कि नहीं आपको ऐसा सा खाना नहीं मैम हमारे पास तो इतना टाइम नहीं है, we are taking this ready to eat. So this ready to eat food हम खाते हैं और इससे once we are getting the time we are cooking, otherwise we are taking this ready to eat. So how much it is harmful? I want to listen from your horse mouth is always a good.
See, whatever is instant money, instant name, instant fame, and instant food, right? जो आता है वो चला भी जाता है. So whatever is instant is never good. If you want to eat outside, make a good choice. Have sandwich, have it without butter, have full half sandwich, have burgers with salad burger, have lime soda instead of fizzy drinks, have coconut water. Have thoda ghar se bana ke le jao. See, today's girls, they need to know how to cook. They should know how to cook. Little bit of cooking is very much important today. Simple dosas, simple khakras, simple cheese sandwich, cheese jam sandwich, egg omelette. These are they don't take very long, right? It takes just few minutes to make. So one should know how to cook and never to trust outside restaurant food. At least now it is good that all the restaurants are shut, so everybody's health will anyways improve. But sing chana is very underrated. The most healthy snack is sing Tanna and chana. Make bel out of it, make chaat out of it, make boiled chana chaat. These are simpler snacks which are really tasty, and they don't take very long to get cooked. Eat मूंगफली अभी आ रहा है, उसको सेक के आप खाओ. It is, if you eat half teacup of मूंगफली every day, you will never be vitamin B12 deficient. Which even you will agree to me, both of you, that 60% younger girls are deficient in B12. Right? Yeah. Have yogurt. उसके अंदर बहुत सारे herbs डाल दो. So use it as dip. Have roasted potatoes. You can make it at home. Roasted fries. Everything, whatever you fry, you can roast it in air fryer. You can roast it in tandoor. You can roast it in oven. There are, if you look into your kitchen, there are a lot of choices.
Yeah, thank you so much, Sheila, for sharing this practical tips. As you told, but hotels are shut down, but takeaway तो इस बहुत आराम से चालू है. पूना में तो बहुत आराम से चालू है takeaway. See, today only I've just gone to my clinic in the Korega Park. Just opposite to my clinic is a new branch of the Pizza Hut. So still means I came back around 6:30. Still the round 10 delivery boys are there waiting there with their bikes with the full of this pizza carries, which is still there.
Yeah.
Yeah,
You should
yes,
know
yes.
how to order pizzas. Order thin crust pizza, order veg extravaganza, order pizzas with less cheese. So at least you are cutting down on some fat, you're cutting down on some maida. And a lot of places, they have healthy list also. So steam momos, instead of fry momos, have steam momos. Instead of fried, have tandoori food. There are a lot of good choices. Even if you have idlis, have dosas with less butter, have genie dosa, have spring dosa, have Mysore masala with less butter or no butter. Dosas can be done made without too much of butter.
Yeah.
So have
You
steamed idlis,
are right,
have
Rajesh.
upma.
You are
Yes,
right,
Dalip?
Sheila.
Sorry.
But I've seen most of the youngster, those who are going to the pizza's shop, they always ask chili and double cheese pizza, and then they
Yeah.
become. बराबर है? So always I
Yeah.
have seen order for double
So
cheese pizza.
yeah. So children also today, and always children, those especially with PCOD, they have hunger pangs, they have mood swings, they have energy swings. To satisfy that hunger pang, people order wrong stuff. So see to it that your sugar level never falls down. See to it that you're always full with some micro snack, maybe a fruit, maybe some sing chana, maybe green tea, maybe lemon water. So if you keep yourself full, if you keep on having in between fillers, you never feel hungry, your sugar level never falls down, you never get hunger pangs, and you never order wrong stuff. Right?
Very true, very true. I got one inbox, Sheila, as you mentioned regarding of the sandwich. The one doctor wants to know regarding the sandwich that which kind of bread is good these days. So we are getting lot of advertisement. Even this the modern bread has started the bread with this turmeric and other immunity boosters, and they are giving the mask also free. I think everybody must have seen that in the WhatsApp. That's become a viral, that multi-grain bread with turmeric along with the mask free. So how much it
Okay.
is?
See,
Yeah,
white bread is not that bad. Okay.
yeah,
Why maida is not good? Because you lose when they grind wheat to fine maida, they lose on a lot of fiber. But if you add a lot of vegetables to it, if you add lettuce, if you add potato, if you add cucumber, tomato, little bit of coriander chutney, so you're replenishing whatever fiber you have lost, you're compensating for it. So no matter whichever bread you use, if you're having 2 slices of high fiber bread with a lot of vegetables without butter, it is fine. ओके
yeah,
व्हाइट ब्रेड को इतना विलन मत बनाओ और होल व्हीट ब्रेड को इतना फोकस मत करो because ultimately they have to add some maida. If you go abroad, what bread we see is very very hard. You cannot make
yeah,
sandwich out of it. You have to have only toasted, right? So
true.
whatever breads we get in bakery today in India, if they're soft, they have to add some maida to it. So even if you're having 2 slices of whole wheat le lo, maida le lo, but add a lot of veggies, add a lot of fiber to it, and that's fine.
Yeah, thank you so much, Sheila. A very practical tip you have shared. Now coming to Dr. Gadhavi. Yeah, Dr. Dalip, our very next important query when this lockdown has started, especially with the gynecologist, as we are dealing lot of the pregnant patients. So, do you
Yeah.
find difficulty while dealing with this pediatrician, anesthetist, and staff? I want to know all about from your mouth.
Yes. See, in the early days, everything was going on little reasonable, but when the number of patients started increases, then everybody started themselves getting corner. So we were getting pediatrician, but so far as staff is concerned, at many hospital staff refused to come to the hospital because they said, "Sir, if we will get infected, what will happen? My family member, my in-laws are refusing me to come to the duty, so I will not come for the duty." So at that time, it was little difficult to get our regular staff on the duty time. Few people were coming, but at few were refusing strongly, and because they were also always supposed to follow the instruction given by their family member. Because after all, they have to stay in their family, so she cannot overrule or overcome her in-laws, her husband, or even kids. The young kids, it is, "Mummy, don't go to hospital. You will get infected, and
True.
we all will get infected." And in the early days, there was the scenario, the people were thinking that अगर आपको कोरोना हो गया तो समझो आप चले गए, बात खत्म। कोरोना हो गया तो समझो, तो एक माहौल ऐसा बन गया था। धीरे 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 लोगों में अडॉप्शन भी आ गया, लोगों में समझदारी भी आई, and government also started advertising that this many patients were get affected, we have cured this many, only the death rate or mortality is this much. So it again, then the confidence came again back to the staff member. So far as doctor is concerned, I think most of the doctors have fulfilled their duties, and hardly they have refused to any patient or to any in any conditions. Pediatrician always they used to come to our hospital. In newborn baby, where it was needed to incubator care, they took it to baby to the incubation. They treated, even anesthetists also they were coming. Only thing in those days, they were little bit afraid by giving the general anesthesia, because so far as COVID infection is concerned, people think it is in the neck area, throat area, larynx are more affected. So they were little bit hesitating while intubating the patients. For spinal, they didn't had any problem, but little problem we were getting across the country, so far as all fraternity is concerned, and because of the many reasons, not only because of their duty is concerned. I salute all the doctors, those who have given their services in this pandemic area.
Agreed. So, Dr. Dalip, my next question to this, that due to this corona pandemic, as there is a lot of psychological trauma to everyone, do you find, we have seen the lot of suicide cases have increased, do you find psychological trauma in our doctor fraternity also? Because we are discussing with you regarding the doctor's lifestyle. So, I want to know what's your experience, what you have heard about from the others.
Psychological disturbances and problem is concerned, the doctor fraternity is less affected, because we being a doctor from the first MBBS, we deal with the dead body. We do our anatomical dissection on the dead body. Then we daily we have seen, irrespective of the fraternity, we have treated patient, we have operated patient, and sometimes we have seen the death. So far as life is concerned, we people are quite philosophical, because we know that one who has come, one who is born has to die. जिंदगी में आना जाने का एक क्रम है। तो ज्यादातर डॉक्टर साइकोलॉजिकल प्रॉब्लम जो है उनका, कोरोना से नहीं डरे थे। हाँ, for newcomers it was difficult to sustain their practice, because all of a sudden everything closed down. They have to pay their EMI, they have to pay their salary to the staff, they have to fulfill their overheads. So for newcomer, the psychological trauma was concerned with the finance problem, because they were not getting the finance at the same time. Whatever expenses were there, it was there. बट जहाँ तक के जिंदगी का सवाल है ऋतु, तो इतना तो हम, या तो हमारे बच्चे जो लोग यंग डॉक्टर्स है वो जानते हैं कि यहाँ आना है, यहाँ से जाना है, और यही हमारी जिंदगी है। अ सोल्जर नेवर डाई। हम एक सोल्जर है, एक बार हम डट के खड़े हो जाते हैं, चाहे फिर वो चाइना हो, पाकिस्तान हो, पेंडेमिक हो, हम वहीं पर डट जाते हैं। तो वो तो बात है डॉक्टर को। I have respect, and the society has also respect for the doctors. Okay, people are doing everything at the cost of your life.
Yes, true. Thank you so much, Dalip, for sharing important point. Yes, with this only I remember I was discussing with some of my friends कि अभी ऐसा लगता है ना कोरोना पैंडेमिक में तो हमारी वैल्यू और भी ज्यादा बढ़ गई है। अभी तो कहीं रास्ते से भी जाओ, गाड़ी में आप जा रहे हो, डॉक्टर का साइन लगा है, पुलिस वाला भी रोक कर आपको सैल्यूट करता है। Yes, thank you, Sheela. Thank you.
It is a doctor and the police. Means doctor, paramedical, everybody from the class 1 to class 4th, and the police staff, constable to DIG. They people have worked very hard, 24/7, and because of that, we can implement this lockdown in a better way. Otherwise, it would have been failure absolutely.
True. Yeah, thank you so much, Sheela. I have got 2-3 questions for you, Sheela, regarding this craving of the sweets in the diabetic patient. So, what the dietary modifications you suggest? I have this question got from 2 doctors. There are 2 queries. One is the constant craving of sweets in the diabetic patient. Other is how to deal for the craving of sweets in the PCOS patients.
Okay. Now one need to understand that if you're having high carbohydrate meal in a first half of like breakfast में आपने एक simple पोहा खा लिया, it is simple carbohydrate, your sugar level raises, right? You felt very nice. A cup of tea and aloo poha made you feel very good, right? The sugar level rises within 5 to 10 minutes to 15 minutes. It turns into sugar within 15 minutes, and after 1 hour the sugar level again falls down. Again it falls down, again you crave for some sweet, so again you have some either chicky or maybe a slice of toast or maybe some sweet fruit or maybe fruit juice or maybe a cup of coffee or tea. Again your sugar level went high, again half an hour, again it fell down. So the entire day you're sitting in a sugar roller coaster. This is technically called as sugar roller coaster, and your sugar level, and you keep on getting your energy swing, your mood swings, your irritability, your anger. Maybe ladies, they cry, they get a lot of mood swings. That those mood swings are because of the sugar roller coaster, because your sugar level keeps on rising and falling, right? So the first thing one needs to understand, that have protein rich breakfast. In the breakfast, don't have large carbohydrate meal. Always have either eggs or maybe in vegetarian you can have sprout salad. They stabilize morning sugar very well. Between lunch and in between fillers, keep on having micro snacks like some nuts or maybe sing chana, maybe a whole apple, maybe an orange, or keep on having herb infused water or maybe green tea, maybe lemon water, maybe ginger water, maybe a fruit infused water if you don't like plain water, right? Then your sugar level will never fall and it will never rise, and your sugar level will be stabilized. You will never feel sugar craving. And always include 2 teaspoons of either coconut oil or it is a medium chain triglyceride. So it has it stabilizes your sugar level. So morning breakfast, if you're having protein-rich breakfast with 1 teaspoon of good fat, the entire day, you will never crave for sweets. Your sugar level will never fall, and you will be much happier and comfortable.
Thank you so much, Sheela. Sheela, but there is one more question with you only. They have written your opinion regarding the use of this cottage cheese. Do you recommend this paneer? Yeah.
Paneer. See,
Yeah.
paneer, every person reacts different with dairy. My cottage cheese, I definitely advocate, but only if it is homemade. Because आप हमारे बॉम्बे में सिंध पंजाब का paneer is very famous, but it is full of malai. It is full of malai.
Okay.
So if you're having high fat cottage cheese, then there is no point. You want to have high carbohydrate food, have it with mixed meal. If you're having with whole dal, if you're having with chapati or maybe bajra roti, if you're having with curd, if you're having with lot of salad, तो उसको वो sweet fruit को उसके साथ ले लो. So the glycemic index lowers and it is safe to have. But again, it depends on each patient, how much is the sugar level, or how much medication he's taking. But usually half ripe mango along with full meal is fine. Only in mango.
And regarding this unripe mango for this pickles and all, they are asking कि अभी हम pickle नहीं खाते. The doctor has written कि we are advised. I am reading the question that we are not advising the patient to have the pickles, but some patients are asking to have this unripe mango कैरी खाने के लिए. So how much it is safe to advise?
कैरी is excellent vitamin C. बट कैरी का पन्हा बनाना है तो उसमें बहुत सारा जैगरी जाएगा, सो इट इज नॉट एडवोकेटेड. अगर कैरी का अचार घर में बना रहे हो, इफ यू आर यूजिंग रॉक सॉल्ट, इफ यू आर यूजिंग कोल्ड प्रेस्ड ऑयल, तो लिटिल बिट ऑफ कैरी का अचार इज फाइन.
Okay, yeah.
But if you're adding too much of chilies, if you're adding too much of spices, then I wouldn't recommend. And if you're having bad oil, if you are having bleached oil, then not to have. Only if you are making it out of cold pressed oil.
Yeah. Thank you so much, Sheela. Now coming to Dr. Dalip. Doctor,
in short, what Sheela is telling, if you want to eat tasty, then you forget about the calories and all other things. Then forget the taste.
Yeah. So, Dilip, my question to you regarding this vaccine. What do you think? What is the scenario, current scenario of this corona vaccine?
Yes, this is a very important question, Ritu,
Yeah.
because there are only two ways to counter this COVID-19.
Yeah.
Either we get herd immunity by getting repeated infection and making our body stronger and stronger to fight against the COVID infection. And another thing is the vaccine, which we doctor know. But this virus, so far as my reading is concerned regarding the virus in the different magazine and newspaper, that is changes its strain repeatedly. So all the companies are finding difficult to get the vaccine for that. Even though the few days back Russia claimed, America also said, even India has also given permission to the few pharmaceuticals company to go for the trial. Even yesterday I was seeing the news that AIMS has get ready to give the trial for the vaccine for the AIMS Institute Delhi. So the moment, unless and until we don't get the genuine vaccine or herd immunity, we don't have any specific drug for treat this COVID infection. Though we are using this remdesivir, tezolizumab, but these are the supporting drugs. In few cases, it gives wonderful results, but in some, they don't give anything result. So, vaccine is the only resource or only hope for us to keep ourselves, means citizens of the world, safe from this
True.
infection.
True. Dilip, my
But it
next
will take
question.
time. See, vaccine is a not easy thing that any pharmaceuticals can make it, because they have to make it. They have to take trial on the animal, human being. They have to confirm that we are getting absolutely result. Only then and then we deliver in the market. So naturally, it takes almost 10 to 12 months. So if we consider that from January onwards, all the world's biggest company of the world has started searching on the vaccine. Naturally, it will be delivered to the people by November or December. Before that, it is not possible.
True, true, true. So, Dilip and Sheila, though my show time is only 30 minutes now, we exceeded more than 1 hour. Still, two, three very important questions I want to, yeah. So, time kaise chala gaya in the discussion, we don't know. Yeah, yeah. So, Dilip, my one question to you, in this scenario, in this corona pandemic, lot of patients we are getting of the sexual dysfunction also. There are two kind of patients. One, तो एक तो हम infertility specialist के पास जो patients आते थे, some patients got the spontaneous pregnancy rates that has a good results, and some patients we are getting lot of with the sexual dysfunction. So, what's your opinion on that?
This is a very important thing, because the whole sociology has changed in this pandemic period and during lockdown. So, see, because of the chances of the infection, we all the infertility specialists have stopped doing IVF and ET and other all things.
True.
So many of those patients who were stimulated by the doctors in the last 6 months, and in their honeymoon period, though they did not maintain the social distancing, but they become pregnant. That is a good thing.
True.
Another, that because of the lockdown, in the small houses, suppose if you are in Mumbai, 1 BHK or 2 BHK flat, and whole family is staying in the house, there is no sexual life for them. Another thing, when you are not earning the money or you are not getting your business or anything, that also affect your mental status. And for the male, you understand the erectile dysfunction is a very, very common problem at any age, at any situations. So in this period, many male patients have get affected by the erectile dysfunctions problem.
Dysfunction.
And after this unlockdown, they have come to know that, sir, though we were at their home, but I could not enjoy my life. And we have to treat them by giving the certain aphrodisiac tablets and other things.
Yes, yes, yeah, yeah. Thank you so much.
Also, as Dr. Sheela told, a diabetic patient, they could not do the exercise or jogging or swimming, what they people were doing in their routine life. So that also increases your sugar level, and that also affect your sexual life also.
Yeah, yeah. True. Dr. Sheera, I want your some tips regarding for this keto diet. So many doctors want to know. Actually, it is a very
I will
broad
not.
entity. Broad entity, but how much you
Is
can
a
compare? Huh.
Never go for keto. I have seen the worst cases,
Okay.
and I never give keto because fast to go and fast to come back. What happens when you lose anything very fast, right? You lose out on your muscles, you lose out on your fat. That's the way you get instant results. And when you stop keto, you have some hypoglycemia, किसी को bleeding. There are a lot of side effects. Then people usually stop keto, and when they gain back, they gain only fat, and muscle will take very long. So they become flabbier, they become bigger. It affects their metabolism, and repeated episodes of this is called weight cycling. You put on, you lose weight. Repeated episodes of weight cycling causes a lot of metabolic syndrome, metabolic disorders, and that is very, very dangerous, right? That causes a lot of CVD, that causes a lot of hormonal disturbance. So I will never recommend keto. Slow, steady, eat and exercise, and never go for those fat diets, never go for those which were fruit diet, keto diet, GI diet,
GM diet. One GM.
काफी सारे
हाँ.
they come, they go, but by that time, by the time it is proven fatal, we have already experimented on ourselves.
Yeah.
So never to do all this, talk about it openly.
Yeah. Other thing, want to know your opinion on intermittent fasting.
Yeah, intermittent fasting is a very in diet right now. So if you have that 16 hours window, I will definitely recommend. So if you can tolerate that hunger, but a lot of people, they do it jabardasti, they cannot tolerate that hunger, they faint, their sugar level falls down. So it's best to go to a qualified dietitian or a doctor, understand your metabolism, understand your they will understand your case history. You should not starve for longer period. So understand it and then follow it. Don't just Google and don't just follow anybody, because it has to be tailor made. Any diet, any extreme diet you're following, it has to be tailor made. So then it will be beneficial to you. But I would recommend intermittent fasting. I do recommend.
Yeah. Any special tip or any special advice for this hypothyroid patient in the dietary advice?
Number one, I think it is काफी सारे लोगों को काफी कुछ पता है. But then one thing I will definitely tell is weight training. If you exercise at least for half an hour, then your thyroid, 30% thyroid if you exercise well. And cruciferous vegetables are not given. But as per new study, if you cook it well and if you have it in later half, it won't interfere with the medication which you are taking in the morning. So absolutely don't ban cauliflower, cabbage, spinach. काफी सारे वेजिटेबल्स ये लोग बैन कर देते, जो लोग लाइफ टाइम लेते नहीं है. Raw salad, but cook it very well and keep that gap so it doesn't interfere. Morning empty stomach when you are taking tablet, don't have at least keep 3 to 4 hours gap so it doesn't interfere. Your food doesn't interfere. High fiber food doesn't interfere with your medicine.
Yeah.
And have a lot of fish. 3 omega works pretty well. If you are a pure vegetarian, I usually give them 3 omega pills. That works pretty well. Have coconut water, have coconut oil. Cold pressed coconut oil does wonder. And otherwise, बाकी सब कुछ काफी लोगों को पता है. But exercise, I would 100% recommend. I have applied it on many people, and the results are excellent. So at least in this pandemic, if you are not able to go out, if it is raining, just simple spot jogging, some cycling, some dancing, some aerobics. So aerobics, people feel that if you pay and if you dance, then only it is aerobic. Aerobic exercise, simple aerobic exercises, biggest muscle of your muscle, that is your leg. If you are using it in a rhythmic fashion in presence of sun, non-stop at elevated heart rate, that is called aerobic exercise. It is dancing, climbing up and down staircase, simple walking, at your own pace, at your own place, do it, and the result and the benefits are tremendous for PCOD, for thyroid, for diabetes, for blood pressure. diet and exercise goes hand in hand, and some kind of weight training that will help you in getting fitter, and that will definitely have a good benefit on thyroid, PCOD, diabetes, and blood pressure, and of course obesity management.
Yeah.
It will boost your metabolism, and that leads to weight loss.
Yeah. Thank you so much, Sheela. Dalip, you want to add something?
बस नाउ टाइम इज ओवर. मुझे एक चीज कहनी
Yeah.
थी.
हाँ.
कैरी होम मैसेज है.
हाँ.
वॉकिंग में डिस्टेंस चाहे भले ही रखो, वॉकिंग में डिस्टेंस चाहे भले भी रखो, टॉकिंग में डिस्टेंस मत रखना, क्योंकि जिंदगी के सफर में जो मकान गुजर जाते हैं वो फिर कभी नहीं आते.
वाह वाह वाह.
Keep social distancing, talking, but keep relationships by talking with each other. और हमारी ख्वाहिश है कि सारा जहाँ फिर अच्छा हो जाए, भगवान की कृपा हो जाए सब पे, और पूरा दुनिया में सब जगह फिर जैसे हम जी रहे थे इसी तरह से हमारा नॉर्मल जीवन हो जाए.
Amen.
Yeah, I mean, thank you. So, before I wind up, my final question to you, Sheela, what's your opinion regarding the use of this dark chocolate?
Dark chocolate, if it is 90% cacao, CA, you read that very carefully. And if it is 90% without sugar, it is a very good antioxidant. It is a very good antioxidant. Have 2 pieces of chocolate along with meal. It adds to your antioxidant, and one should have.
So thank you so much. With this, I think we will wind up our show. So both of the Pundits have done the very excellent. As Sheela has also given the permission that 90% cocoa is good. So I brought these 2 chocolates for both of you, having a 90% cocoa. So whenever we meet, this is from my side to you.
So sweet of you. Thank you so much for inviting us. It was really nice talking to both of you. And we really enjoyed Dr. Ritu and Dr. Dalvi.
Yeah.
Yes, thank you.
Hope to see you guys again.
Yeah, sure. With this, we will wind up. Over to you, Sankalp.
Sheela ma'am, and thank you so much, Dr. Dalip. It was a really nice practical discussion and eye-opening discussion we had together. Thank you so much. And we are from Innovcare Life Sciences. We have iron brand, Innofol HB, and pre-probiotic brand also, Pro Innofol. So these are the 2 brands which can fit into this today's scenario, man. Thank you so much.
Definitely.
Thank you so much, Doctor.
Thank you for giving us opportunity.
Thank you. Thank you.
Yeah. So before we wind up, I want to end with these 2 lines, as Dr. Gadhavi has also mentioned the 2 lines. I also want to, because in this corona period, we all get so much of tensed and depressed, whether the doctor, whether the general patient, that कि जिंदगी में चुनौतियां हर किसी के हिस्से में नहीं आती. जिंदगी में चुनौतियां हर किसी के हिस्से में नहीं आती, क्योंकि किस्मत भी किस्मत वालों को ही आजमाती है.
Wow.
So
well said. So well said.
Yeah. So have patience, stay safe. On the next week, we are again meeting with 2 very important topics. On Saturday, we are meeting the friends with the topic, this ART, what is the medical legal aspect, with our very own friend, Dr. Geetin Sharma. And Sunday, we are discussing the female sexual dysfunction with Dr. Padmani Prasad. So stay tuned. We will meet soon. Yeah. Thank you once again, Dr. Dalip and Dr. Sheela.
Thank you so much.
Thank you.
Bye.